We'll have to wait. There's an issue with the minutes, Chair. We'll have to submit them next time along with these.
Okay. And then intelligence update is next on my agenda, followed by health protection board, followed by community engagement, followed by vaccination inequalities. Have you got anything else, Andrea? Or is that it?
We were going to suggest that Mark talked about the roadmap after Anthony's intelligence update.
All right, roadmap.
That's helpful.
Yeah, roadmap. I'll put
Thanks,
it in.
that's
now.
it.
Okay, right. So intelligence.
Okay.
Over to you, Anthony.
Are there some slides that we send?
I should try and pull them up.
Have they come up yet now?
Just hang on. If you want to make a start, Anthony. And
Yeah, I will do. I will do. Well, the first slide was going to just be a bit of an update of what we've been through, which is we know that we had a peak post-Christmas and pretty bad numbers in early January, which was our peak of cases. But it's very interesting to contextualise where we are now by looking backwards. Otherwise, you have these debates which are with the worst in Greater Manchester, but we're not seeing it from the lens of how well everything is going and how well we're doing. Off the top of my head, which is, I think it's reasonably accurate, the number last week, which we've got as the official number, was 280 cases, which just puts us around about just over the 100 mark per 100,000. Now, obviously, this has come down from rates where we were at things like 400 and 500. So I'll just try and click on, oh, I need the second slide. I don't know. So, yeah. Can we see this? It's a little bit blurred. So we've come down and everything's starting to point in the right direction. Positivity rates down, and hospitalizations have always been a little bit tricky to measure because we've not been able to measure hospitalizations for Rochdale residents very well. But the data in that direction is also going down. Now, last week I was quite concerned because the deaths were at 15 again, which is, I was hoping by this stage we'd see the deaths starting to fall. But the latest data, what you have to remember with the death data is it's kind of always out of date for two reasons. One is the official statistics are from 2 weeks ago, and then death is measuring something that happens prior to that. So you're always looking quite backwards in time with those figures. But the latest figures now, our death rates have dropped to 11, and colleague Martin has kindly provided the death data from the hospitals, and that's looking incredibly positive now. And it does seem that we are definitely going in the right direction now, and we should see a dramatic fall in deaths very soon. Next slide, please. So this just really recaps that what we've been through. So the worst period was November. We had the large rise in cases. The cases arrived in September, which of course was interesting because that's when schools went back. What we have now, of course, is schools are going back again, but we're hoping not to see a similar rise in cases. The case peaked in January, as I just said, but the trend now is downwards. But what we've tended to have each time we've come out of lockdowns or started to release lockdowns is a kind of plateauing of cases. And it's been incredibly difficult to get the R number down below 1 in certain populations. So we're seeing this overall fall, but we're now starting to see something which we saw in the past, which is Rochdale tends to plateau instead of being able to drag it right down. Next slide, please. Right, so what's next? Well, we should, and I think this is now definitely going to happen, that we'll see hospitalizations and deaths fall very rapidly. This will create an interesting challenge And that challenge is going to be that we may see a small rise in cases because of release of different restrictions. But the question is, if we're not getting the hospitalizations and deaths, how should we react to small rises in cases that we may see? So I suspect we're likely to see a scenario which was quite similar to last summer, where last summer, you can remember that we had more cases than some other areas, but what now seems like, as we just discussed, we were down at 50, which now seems quite a modest rate. But we had more cases than some other areas, and the spotlight was on us. And I think this is going to be the big thing moving forward, is trying to finally drive out in certain communities the rate below this sort of magic figure of, let's say, 50. We should, as I say, see very shortly really firm evidence of the impact of the vaccination programme. I think it's now just about emerging where we can be pretty confident, with the rates going down in the over 60s, that hospitalisations will soon fall. And I'm suspecting that we'll have, as I say, a dramatic drop in the death rate. Final slide, please. So conclusions, well, lockdown has reduced the cases, and no doubt about that, and vaccinations are going well. I think Wendy's going to talk about that in a little bit. We can't yet show this absolutely definitive, because you get the cases jump around a little bit because of variance each week. But everything's pointing in the right direction, and we should see this completely superb picture moving forwards of week by week, we're getting better and better. But we're going to have an issue with pockets of infections. Currently, over the last week, we've seen it in the Kingsway ward, and I think there was one other ward which I'm uncertain of. And we're also seeing a slight increase in, it's not an increase in rates as such, the decrease in almost everybody, but a less rapid decrease in the Asian population. So we're seeing some things that emerged during the summer emerging again. And this is almost certainly to do with the incredible difficulties that some people are facing in certain communities, because when it's just so very, very difficult to get it out of very small houses if they're overcrowded, and certain population groups, it's just so difficult to actually reduce it down to one. I'm just going to talk for a couple of minutes about inequality, because in the not too distant future, we're going to be in the position where the COVID death rate is not a very, very important proportion of all deaths. At the moment, it's still an important proportion, but it's going down and down. So the question then becomes, when it goes down sufficiently, should we then be shifting or looking more carefully at what else is causing health issues? And one of the biggest health issues that's being caused by the pandemic is a widening of inequality. And this is an interesting story. What we have is a mechanisms that have widened existing inequality. And those mechanisms are things like the death rate from the virus itself being higher in certain population groups, so that it's impacted poorer people more. A classic example being that poorer people tend to have more health issues. COVID-19 impacted those with more health issues more, therefore poorer people got hit worse. And then, of course, the necessary response to the pandemic, and it was necessary, we've done the calculations, and there would have literally been way over 2,000 deaths in Rochdale had we not had lockdown restrictions and the such like. I mean, we know this because in 2020, 15% of the population were infected. So if you imagine that increased to, let's say, 60, 70%, you would have to multiply the number of deaths we've seen by a factor of 3 or 4. So we know the lockdown was important, but we also know that it caused a lot of harm. And of course, the harm from the lockdown wasn't distributed evenly. And this has created inequalities, and it's created two types. One, it's exacerbated the existing ones because people who were in the lower socioeconomic groupings tended to have the types of jobs that were lost because of lockdowns, things like working in the hospitality sector, being an office cleaner and such like. So it worked in that way, but it also created a load of new inequalities, which we haven't highlighted or spotlighted before. And I think this is important because these new inequalities are things, for example, like a cancer patient being treated before the pandemic got better treatments than they did if they were diagnosed during the pandemic. So it is an obvious inequality there. Similarly, we see in the jobs section, it's mainly hit younger people and older people. The statistics are that 7% of all jobs have been lost for 16 to 24-year-olds, whereas in the working population of 16 to 64-year-olds, it's only 0.5%. And obviously, this is somewhat because of furloughs and the such like. But there are these inequalities that are new that we've not previously looked at. And some of them are sort of kind of obvious, but you wouldn't really necessarily think about it in terms of when you look at a population group, within that population group, who did well and who didn't do well. So we're going to now have to expand our lens when we're moving forwards, because the pandemic will soon be over. And after that, we're still in this sort of crisis management situation where we really, really have to look very, very carefully about inequality. The final point I want to make on inequalities is the expansion of people who are falling to the bottom of the pile. And this is really, really crucially important because the lockdowns and restrictions created a sort of recipe for making people fall downwards in society. For example, if you were locked down with someone and they became abusive, you're very likely to want to leave them. People have lost their jobs. So we may see this sort of combination of people who have had multiple things happen because of the pandemic. They've lost their relationships, they've lost their employment, and they may now be losing their housing. So we have to consider when we're thinking about inequalities, how do we catch those people who are falling rapidly and they might be very unused to this situation as well. So how do we sort of trampoline them back up rather than have them fall to the bottom of the pile and then become disillusioned by these things. So I know I'm normally quite cheery, and I'm cheery about the end of the pandemic, but I think we have to now be aware of the very, very important challenges ahead. Thank you.
Sorry, I was a bit slow on the microphone. Comments, questions, observations from anybody? I can't see any in the chat, and I can't see any hands up.
Councillor Hemsley, Chair.
Okay, Janet.
Just asking Anthony if we've got any kind of detail on the number of positive cases that have been identified in the school testing.
I can't provide, there will be probably, I can't provide an answer to that, I'm afraid. I don't have that data at this point.
That's okay, thank you.
Is it
I'm not sure.
a bit early yet or not?
It may well be. I mean, we can strive to get it and send it you as a response.
I was just wondering, for example, Leader, what Anthony said about the Kingsway spike. You know, is there a difference between Kingsway and Hollingworth, etc., in the number of positive cases that?
Yeah, I think what he was talking about was Kingsway.
Yeah, I know. Yeah, I understand that, but you know, is there a bigger impact on the kids in that ward? Is it transferring down? Is what I want to know.
Well, yeah, and of course, I'll bring you in a minute, Denise. Of course, now Hollingworth High School has a very diverse community because they come from all over the borough. And although Milnrow itself has a very, well, a negligible BAME population, I think 20 to 25% of Hollingworth High School is from the BAME community. Okay, Denise.
Thank you, Chair. It's just a comment really for the organisation, for both the CCG and the local authority. With what Anthony's telling us now, we already know that the children's services have had to increase their workforce because of the demand for children's services during this pandemic. But what Anthony's told us now, do we as organisations need to ensure that we've got those services in place at the level we need them to be to support these people that are falling through the system, that are being negatively affected?
Yes. Yeah, I think
Got to
it's.
respond to that, you, Anthony.
Well, I think this is a flagging up situation at this point. I think there's quite a lot of work to do to identify how we can best utilise the resources we've got to make the maximum impact. But I think there's some of the key findings will require more. I mean, there's just going to be more demand for services. Every single indicator you look at, except smoking, is going in the wrong direction. So there is undeniably a need for more service use, and we have to be incredibly careful with that we make sure that the services are provided in a very fair way. I think equity is a huge issue here, because what we're going to have is a necessary rationing of some services unless there's a huge increase in council budgets, which seem unlikely.
Okay, I've got Mr. Widdop and then Sarah.
Yeah, thanks, leader. I just wanted to sort of just give some assurances around, because what we're talking about and what Anthony's talking about here is COVID recovery. And that isn't just for the council, that's the system recovery that's needed. And that's, of course, picked up at a regional level as well as at a local level. And I think that's really important, because I'll give you an example. The work, for example, we've set off around the Community Champions project, that isn't just about looking at the issues now, but how do we build in safeguards and a sustainable approach to parts of the community who, as Anthony has said, are going to need some of that intervention and some of the support, but on a good help basis, about how people can then obviously get support, but then as part of a sustainable approach about how they can then become better at helping themselves, and also communities then becoming better at helping people within their own community. So I think it is certainly work that we've been discussing. We've got, I'm sure if Gail was on the line and others, there's lots of work being done. And I think that is something that we want to sort of bring forward at pace now as we go through these next steps, to make sure that whenever this happens, whenever we can say we're out of COVID, that we've got those plans in place. But as I say, I'll just stress, it's not just for the council.
Great.
This is around a system recovery, which is really important. Thanks, leader.
Sarah.
Thanks, Chair. Can I apologise again because my camera isn't working on Zoom? I don't know whether. Thank you, Anthony. Your reports are always really, really informative and really helpful and give a really clear picture. I worry about the families of people who've died, and that we've got mental health support services up and ready and accessible and easy to get to, and that they have the capacity to be able to deal with people's grief. And it might be premature to kind of think that we need to do at some point some celebration of the lives of people who we've lost, and acknowledgement of the numbers of people in our communities who are no longer with us. This might, and I really don't want it to sound facetious, but are a bit weird, but there's a big article on the news recently about the increasing rates of sexually transmitted infections, and whether that is something that's also a concern in our borough, because is that an indication of, I don't know what it's an indication of, except that people certainly aren't isolating or following all the rules. And I just wondered whether we've seen that unwanted unplanned pregnancies as well, whether that's something that we have to add to the mix. Thank you, Chair. Yeah. Oh, hold on, I came on then, didn't I? Sorry, that I'll mute myself very quickly so I don't sound hysterical.
Okay, Martin Halls put something in chat about look into the question for Councillor Emsley. Is there anybody else or anything anybody else needs to comment? Oh, Andrea, you've got a hand up.
I have. I've worked out how to do it. It's great. It's just to kind of sort of answer the question partly. We are especially interested in, as Mark said, and you know, obviously, as some of the other members of board have highlighted, some of the consequences of the pandemic. And what we're looking at is that pyramid, if you like, of you know, effects. So right at the top, where you've got those, you know, those diseases of, you know, for particularly for mental health, you've got diseases of despair, you call them, sort of alcohol, suicide, drugs related. You've got consequences of reduced access to health services, and that could be the sexual health impact that you're talking about there, Sarah. It could be other things. So we're just trying now to unpick some of that. There's lots of work going on locally and regionally and nationally around the emerging inequalities in health that we're picking up now from COVID. So I suppose watch this space around that, and you know, we'll be bringing that here to board to discuss. Thanks,
Okay.
Chair.
Thank you. And of course, Janet says, reflection, celebration of life. I've already done a video for March 23rd, and I'm sure other people are doing them to reflect. And I'm sure it'll become an industry in itself, reflections. Okay. Is there anybody who wishes to say anything else? Okay, Kate Jones, Equalities Assembly next week, which will discuss some of these issues with local people. Thank you. All right, I'm really getting good at this chat and recognising hands up. All right. If there's nothing more on that, can I move on then to roadmap? This is you, Mr. Widdop.
Yeah, that's right.
I don't know when you got your degree in geography, but if you go off the road, I'll soon bring you back on.
No problem at all, Chair. I've just got a couple of slides. Just tell me when this has been shared, if you would. Can you see that?
I can. Thank you.
Good, thank you. So there's just two slides, Chair, and I suppose it is a neat segue into what we've just discussed, because with all the things that are going on currently during COVID, a lot of attention on, quite rightly, on vaccination, on testing, still on infection rates, etc. There's about, and it started already, of course, from Monday. There's about to be some significant events that are planned through the roadmap, and obviously the first one's happened already, which is the schools going back on Monday. But I just wanted to remind people, the first slide I put up there is all the assumptions around the easing restrictions are based around these 4 tests. And the governments have been very clear that these are not guaranteed. So when I come on to the dates in a second, they are very specifically mentioned as no earlier than. And that's because if these 4 tests aren't met, there is a risk that some of those dates may well move. I won't read all those out, but you will have seen those before. And then equally important, the last bit of that slide is that there are 4 big programs of work which are currently going on at government level, which are going to then inform some of those key things going forward. And we'll all be interested in the majority of these, particularly travel. But one of them is around COVID status certification, which again, that's got a lot of publicity at the moment. The second one is around large events, how we're going to get large groups of people together. A key one around international travel, but that isn't just about the UK, that's about what other countries are doing about their accepting visitors. And then the last one is around social distancing, which again is really important. So those 4 pieces of work will report as we move through this roadmap. So just moving on, what I've done is Danny actually provided a very good single slide. I've got about 5 or 6 slides with all these different things on, but this captures the key things that are happening at some of these key milestone dates. And I just wanted to highlight some of the things that are going to be happening and the work that we're going to have to do, not just as a council, but as a council and partners, and as well, and I'll maybe invite Danny to mention at the end some of the work we're doing around communications around this, because there is some chance that the public will become quite confused as we go through this process. We are in public, so I'll just say as much as that. I think there will be some confusing messages for people as we go through. And part of our job will be try and make those messages as clear as possible. Because the thing I want to stress is that whilst all these things are going through these different plans and through these different dates, we'll have a fairly robust vaccination program, hopefully moving through at a pace. And we know that through these different dates, behaviours are going to change, because as people are allowed to do more things, particularly, for example, one of the key areas is around the 12th of April and the 17th of May. When you've got sort of retail opening again, you've got outdoor hospitality, and then in May, you've got indoor hospitality. You've got the ability for people to go to gyms again. So you can see that as a society, people will be feeling like things are going back to normality. But you'll see also in this document that some of the caution around social distancing and some of the discipline that we've had has to continue through this process, because if it doesn't, there's an equal chance that infection rates could start to go up again. And if you go back to those 4 tests, if some of those 4 tests are not met, then clearly some of those steps that we're all looking forward to may well be moved. And I'm not suggesting that's down to the government how they do that. And they are working very hard at the moment to keep a national position. And of course, I'm sure they'll want to keep that. But we'll observe, I think, with some interest what the discussions are then, whether or not there are disparities that start to appear across the UK. And we'll see how that is dealt with as we get closer to some of these areas. The other key thing, which is part of our engagement, of course, is giving that support to our local businesses. And again, some of the members will be aware that as part of this, particularly opening up retail and also hospitality, we'll be communicating very quickly some of the new grant that's available now from the government, particularly the Restart grant that's going to be available for retail and also for hospitality. I think from memory, hospitality is up to £18,000 based on rateable value. So each of those different venues might get different amounts. So clearly, if some of these venues are looking to open up, then they'll be seeking some of that support. And I know that other officers in the council are working hard to make sure we can do that. There's lots of work going on currently to sort of prepare ourselves for each of these time frames and to make sure that we're in the best position we can be. And we're expecting to get a week's notice of each of these steps. That's what the government's indicating at the moment. And once we get that green light, we'll obviously then start to move through. I think the one thing I'd want to stress through all these different milestones is that the way we communicate with our population, with our residents, with our businesses, is going to be really important to make sure we can make what is quite a complex set of actions as simple as possible. And that's something we're working very closely. And again, I will invite, Chair, if I can, just to ask Danny just to outline some of the things that we're doing around our communications plan for this, but also working closely with partners. For example, the relationship with the police will be really important going forward, particularly when licensed premises start to open up. So, for example, on the 12th of April, it's likely that very few venues will open. Now, that might be a good thing, but it can also be seen as a challenge because we'll have more people wanting to get into, outside, of course, get into less venues, which again could cause us some problems. So I just wanted to outline that, Chair, because I think it is something that, you know, we'll have to sort of treat very carefully. And if I can, with your permission, just ask Danny.
Can I, just before you go,
of course, yeah.
Right. Could I suggest that diagram, which you've put up, and I think is quite good. In fact, it's more than quite good because it answers some of my questions. because when you said at the beginning, people are getting confused. I'm joining that group. All right. I started to ask myself when I can go to the gym.
Yeah.
Okay. And it's things like that. Although I don't play golf, I understand that comes up. And I think it's those sort of things. So if we could have that printed off and bigger put up, and that may be useful to put that chart up somewhere where it can, I don't know if Danny can do that, because that I think shows where we are. I'm equally worried as you are that now that we've started relaxing, people are beginning to think that it's, you know, it's over, which it isn't. Okay. So that's a worry to me. And the other thing is, we just need to keep reinforcing the message. So I'm totally with you there, Mark.
Yeah.
That, I think that chart should be sent at least to every councillor and perhaps to as many people, influencers as we can, because I think that highlights where we are.
It's a good summary. Yeah. And I think the final point I'll make before I ask Danny maybe to comment is that obviously there are other things as well which are quite critical, one of which is the furlough scheme. Now, I don't think it's an accident the furlough scheme has been extended till September. And I think that has been extended with a very clear warning that if the tests are not met, then those dates that I've put on that chart could slip. But I think the other thing, going back to Anthony's presentation, is that the furlough scheme could be hiding a lot of issues for us. So actually, from an economic perspective, once furlough finishes, or once some companies decide that they're going to potentially open up again, maybe with a smaller workforce, or that is something again that we are going to keep a close eye on, because that is again something that's quite critical for a place like Rochdale Borough about how we're going to respond to that. So I think that's why all these things are interconnected, Leader. But could I ask Danny maybe just to make a comment, if I could?
Yeah,
Thanks,
over to
Alan.
Danny. Yeah.
Okay, can everybody hear me okay?
Yes.
Yeah, okay, thank you. So as Mark said, we've got to make these messages about the roadmap out of lockdown as clear as possible. But at the same time, we've got to continue communicating lots of other things connected to the pandemic, like the vaccination programme, testing, business grants and loans, support, mental health services, schools, advice for families. We've recently been talking, of course, about the return to schools and the new angle about testing in schools and also care home visiting. So that was the first stage that started this week on Monday. And we're now being asked to look at encouraging families to continue testing. So that is something that we're going to start looking at this week. How can we try and keep people picking up the testing kits, complying with the testing regimes in school, because it's an important part of the defence against the virus. Just picking up the leader's concern about people relaxing too soon. This is something I discussed at Gold last week. So at the same time we're communicating all these different stages and all the different advice to people, we are trying to remind our population that these dates aren't guaranteed. So they come with very big caveats and conditions that need to be met. And we're reminding people as much as we can do that it's important that we all keep following those guidelines and rules and we don't relax too soon. Otherwise, these dates are in jeopardy. We've also got to do things in between all of the dates. And these are kind of issues that sometimes arise out of the blue, and sometimes we're trying to predict things. So this week we're looking at sharing message about Mother's Day. We're trying to advise people about how they can see the mums safely. So at the moment that's only outside and it's only one other person, but of course you could already still be in a support bubble with your mum. So there's all those kinds of things we're trying to help people navigate. And as others have said, this is really complicated stuff, and it's quite difficult for us to get our heads around sometimes. So it's not, I'm not patronising people out there by any means. I'm recognising that this is really complex, and it is really difficult sometimes for people to negotiate. The next point is obviously 29th of March, and the big one there, I think, for people is about the rule of 6 outdoors. So again, we'll have to look at that. We'll have to prepare people for that. We'll have to give them the advice that they need to be able to move to that next stage safely. So I think that's a snapshot of what we're doing around the roadmap. But if anybody wants more detail, I'm happy to provide it outside the meeting. Thank you.
Okay, Sarah.
Thank you. It's just for some clarity as well, really, about mask wearing. I know that in schools it's not compulsory, but students are encouraged. I think if there could be a thread somewhere in all that messaging about do we wear our masks, do we not wear our masks, you know, is it still going to be compulsory in shops? What about the outside events? You know, I think that would be really useful. If you've had a vaccine, do you still have to wear your mask? You know, it just adds to the confusion of going outside again, really. Thank you.
Yeah, thanks, Sarah. I'll probably depend on my public health colleagues to steer us on that one. But yeah, I mean, I went into a shop today. It's mandatory to have your mask on. So, but yeah, I'm with you. It's another thing that adds to the confusion, doesn't it, for people? But I know the whole sense of social distancing will be looked at, as well as face coverings, as we go through these different steps. So yeah, we'll try and make it as clear as we can. Thanks, Sarah.
Okay, I've got nobody else. No. So the next one is Health Protection Board and Outbreak Plan Update. Who's doing this?
Thanks, Chair. It's me. I'm going to do a combination. This set of slides covers the last 3 items. So I'm going to hand over to colleagues as we call through the slide set, if that's okay.
Yeah.
I'll just share my screen again. That worked?
I wish you wouldn't keep asking me when I've muted. All right. The answer is yes.
Fine. Sorry, I can't see anyone. That's why. I'm just going to just do a quick update on these 5. These are the core parts of our outbreak management plan. The plan, there's a national requirement for us all to update our plans. Our plans were done around about 7 or 8 months ago. It seems like about 2 years ago now, but time to review them, certainly in the context of the learning that we've had. So these are the key themes within our outbreak management plan, and this board oversees this plan. So I'm just going to go on a quick canter through the testing, just a couple of highlights. We're seeing that people are not accessing testing as much as they were, and that's definitely the case for PCR. People, we wonder whether the impact of the vaccinations has had, has had an impact on testing. So that's an area for concern. We are still, though, averaging between 3,500 and 4,000 lateral flow tests each week through our fast tests, which is great. So we are seeing uptake of our fast testing. We've got also this new arrangement around Community Collect, which is a new distribution route for lateral flow devices, lateral flow tests for the community, to widen out access to those tests, and also to support the schools reopening. So some quite good developments on testing, even though, I recognise, and I think we've seen that in the news around the limitations of testing. I think what we've got to remember is that the testing strategy that we've got is not perfect, but it's part of a bundle of measures. So testing on its own isn't the solution to managing the pandemic. It's just one part of, a bundle of measures that we're doing. Masks, I think we were talking about before, is one of them, and obviously the other social distancing measures and vaccinations too. So I'll just move on. Contact tracing. Yeah, we are seeing a kind of similar picture, I suppose, with contact tracing. We're seeing, definitely seeing some people who are positive who are not leaving contact details. They're not sharing those contacts, even though it's clear, it becomes clear later that they've had contact, and some of those actually in some of our some of our workplaces that we would really we would really want people to be saying, actually, I work at this workplace, I was in work last week, and then they're sometimes not doing that. So that's an area for us to work on, for sure. I'm just going to move on to we've got a significant program of work for our vulnerable. I'm going to ask Diane and maybe Mark to chip in on this, because I know that they've been working on this really closely and we've had a really good response on this side. Is that okay, Diane?
Yeah. Oh, my voice is going. Yeah, thank you. Listening to all these conversations, I think this support that we have here for the vulnerable is really critical. Going back to Anthony's presentation and talk about catching people before they fall, because I think some of this sort of support we have here is like the first steps to that, and this gives us an opportunity to build, on this moving forward. I mentioned the winter grants that we have at the last meeting, and we'd secured £936,000 for these winter grants that had to be spent by the end of March. And this is really focused on basically keeping people warm and keeping people fed over the winter period. And we'd already identified how we could best use that money. The biggest chunk of it was being used to support children on free school meals over the holidays. So we were managing to continue with our Aldi voucher offer, and that was through the sort of half term before Christmas, and then over the Christmas period, and the half term in February. And not just the families on free school meals, but also an additional 1,500 sort of children in need. And we'd also put some money into our household hardship fund that we'd set off to really support families around fuel vouchers and vouchers for supermarkets. But luckily, a couple of weeks ago, it was announced that we were going to get an extension to that scheme. So they've extended the date to the middle of April and provided us with an additional 325k, which is fantastic, because that means we can now continue to provide Aldi vouchers for our free school meal families over the Easter holidays, which I think is a real positive. And we're also looking at how we can continue and sort of step up a bit more our support for people around energy, especially I'm working with Groundwork and Sin's advice around how we support people who are in debt around energy, and working directly with those energy providers to sort of try and tackle some of that debt, because it's these sort of barriers, it's these sort of issues that will make people fall, won't it, as we come out of lockdown. So the winter grant is really positive. I'm sure you've all heard about shielding. So we did have 8,000 plus residents across Rochdale Borough who were shielding and have been shielding on and off, haven't they, throughout the pandemic. And we've been supporting those and keeping in really good touch with those and ensuring that they have support around food, mental well-being, etc. Now, they've recently increased that. We now have an additional 7,315 residents who are on that shielding list. They've widened out the criteria, so it's not just around your sort of long-term conditions and your medical health, but it's also around your individual characteristics, so things like obesity, around your weight, it's also around your ethnicity, and we've had additional people added to that list. So again, we've been making sure we communicate with those people and to make sure support's there, and we will be securing some additional funding to support those. So we're looking at how best to use that. And just to mention on top of that, we have aligned some of our outbreak management funding to support homeless and housing agenda, because there's massive pressures coming there, and we really want to be able to enable that team to prevent people who are, you're looking at addictions and evictions, and mortgage repossession, so that we can really try and do some more support there around housing. Thank you.
Thanks, Diane. The next slide talks about the influencing behaviour work that we're doing. We've got a significant programme of work around this that stretches across all of our programmes and is obviously helping to strengthen our comms response as well. So I won't go into detail on that. And we've also got a big program of work around workplace prevention. Clearly, you know, we've got a number of significant businesses of significant sizes. We are, you know, we're a workplace. The council is a workplace, you know, Riverside's a workplace. All of our primary care centres are workplaces too. So we've got a very specific work stream looking at that and making sure as well that our workplaces are safe places to come back as we start to ease some of the measures that we've got in place, making sure that our workplaces are ready for that. Schools, I'm not sure. I don't think we've got anybody from schools today. I wonder if Kieran.
Mr. Widdop wanted to make a comment on that last slide.
Yep, sorry.
Well, thanks, Chair. Yeah, it was just obviously just to expand on what Andrea's suggested around the workplace readiness, because as she said, there's significant work now done to refresh and relook at the risk assessments for all our council and partner buildings. Particular focus on, as I outlined in the roadmap, for example, around leisure centres, working very closely with Link for Life around the reopening of those centres, working particularly where we have at the moment, for example, vaccination centre and test facilities at some of those venues. So how we're going to manage that. And I thought I'd just also mention, Chair, that we're also got a piece of work around COVID safe elections. So we're currently undertaking 100 risk assessments for each polling station, and that'll be followed by risk assessments for the count venues, etc., etc. So again, that's another focus we have, that although there may be an increase, or there will be an increase in postal votes this time, not just in Rochdale Borough, but nationally, I would expect, there will still be lots of people who we want to give confidence that coming out voting is safe. And we're spending a lot of time and effort to make sure that's the case. And we'll again be communicating that very clearly closer to the time. Thanks, Chair.
Thanks.
Continue, Andrea.
Yep. Just the schools. I know that our schools have had a really good response this last week with going back to school. I haven't got an update myself. I just wondered if Kieran has anything that he would want to flag up, because I'm not sure whether we've got anybody from Children's here today.
Thank you. Nothing really. There's no headlines come out from this week. After all, it's our third opening, because we opened in June, if you remember, and then again in September. So this is the third time. So all the schools are used to it. They know the routine, they know the regime. All the schools have been well prepared and well briefed as well. They will have to carry out a risk assessment relevant to the 8th of March reopening. They've had to revisit that as well, so they've all been passed. So there's been no really important events or no headlines that cause concern at the moment. So I'm hoping it'll carry on that way.
Thanks, Kieran. I think everybody who's been looking out their windows as well, it's been really great to see our kids, you know, going to and from school as well. I think that's. Yeah, I thought so anyway. My young son's been going back, so it's been good to see.
There is an opposite view. I happened to be in Milnrow Village on Monday morning, and there was a major traffic jam. That's all I'll say. And why? And if you know it, of course, on a very narrow street, why they couldn't drop their 11-year-olds plus, or it'd be 12 mainly now. Why they couldn't drop them and walk up Stonefield Street, I don't know. And I still can't get my head around that children of 12 and older still need taking to school.
I think that's a very good point you're making there, Alan, about, you know, drop and go, about walk and march, because, you know, there's nothing wrong with children being asked to walk another 500 metres or 100 metres, anything. You know, this point about having to drop them right at the door causes so many problems in schools all over the place. So it really is a good point you flagged up there, Alan.
Hopefully we can build that one better.
Indeed so.
There's a slide here on enforcement, which is part of our regular slide set. I think it's just to say as well that we are still dealing with a large number of investigations in complex settings. We've still got a lot of reactive responses happening. It kind of has gone, I'd say. It doesn't
Andrea,
look-
you haven't put that one on your screen.
Ah, can you see it now?
No,
Hmm.
it's slide number 9. There you are. It's there.
Is it there now?
It is.
Apologies. Yeah, it's just to say that we're still doing a large amount of this work, and it goes under the radar, I think, this, unless we get a high profile one that comes onto our, in our path, if you like, in the media. But it's just to say that the managing the pandemic will require ongoing enforcement, particularly if we want to keep those rates down. So yeah, certainly as we start to reopen as well, we will want to be looking to our businesses to be compliant. So this is going to be really important, and our communities as well. So yeah, so a very important piece of work, even though, like I say, a lot of it does go under the radar. I know Mark manages health protection team, the public protection team, and he will testament to the amount of work that they're still doing, I've no doubt. Vaccinations, I know Wendy's on the call, is that right?
Yes, I am.
Hopefully the slide has come up.
It has. So obviously this changes every day, but over 72,000 people have had the vaccination. So we're working through the vaccination programme well. Second doses have also started. So obviously it's quite a complicated programme as you get first doses and second doses going at the same time, and people go back to the same site to do that. Hospital Hub at the moment is focusing on health and care workers and informal carers as a cohort, and the primary care sites are currently focused on the people who are clinically vulnerable, and also starting to work through other cohorts, age cohorts as well. You will have seen that national sites perhaps have opened up to 56-year-olds, and I think today or tomorrow we're opening up to 55-year-olds. So those sites did open up. We just got a day's notice around that. People have been invited to those. There aren't many slots currently at those sites at the moment. So in terms of our local procedure, we will obviously get round to, so the people who don't go to one of those sites, and that's the Etihad or the pharmacy sites across Greater Manchester, they will of course get an invite from the local primary care centre as well, so people don't need to worry if they're not able to get to the Etihad, and we've re-emphasised that message, and the practices have messaged all of their patients with that information as soon as we heard that the information was going out, so that people knew, and also to say to them, please don't ring the GP at the moment or the council at the moment. The invites will follow if you don't actually and are not able to get to the Etihad. If people are able, then fine. As we've said before, we've got two arms of this programme. One is getting people vaccinated as quickly as possible and as many people as quickly as possible. The other one is picking up the health inequalities work, and that health inequalities work is well underway. And that's a whole variety of things, from communication programmes, street engagement, community engagement, and also the development of pop-up sites and roving models in different settings. This week, for example, there is a pop-up going on as we speak, and last week there was work done with the homeless community to actually reach. So in different ways and different methods are used to actually make sure that people don't who don't fall behind in certain areas or in certain groups. We're just writing up some of that work at the moment to inform our next steps, but we're continuing. We've got enough information to know that some of those approaches are working, and we need to continue trying those in different parts of the borough where uptake isn't at the same rate as other places. So the plan's on target, and maybe even ahead of target. All of cohorts 1 to 9, that takes you down to the age of 50, and all of the clinically vulnerable people aged 16 to 64, all of those were on schedule to complete by mid-April, if not before. When we complete it will all depend on vaccine supplies. We've had a lower supply in the last couple of weeks, like everybody nationally has had that experience, but we are seeing more supplies coming in the end of this week and definitely into next week. So the programme will be seeing more invitations going out over the next few weeks. And then we'll get into cohort 10. And the decision nationally for cohort 10 is to carry on working through the age ranges. So that will get down to the age of 16, although 16 and 17-year-olds can only have the Pfizer vaccine. They can't have the AstraZeneca vaccine. At the moment, there's no children's vaccination licensed at the moment, but work will continue with research organisations to look at that. Second vaccinations are a priority. So we get supplies for second vaccinations, and then we get supplies for first vaccinations. We're obviously interested to see how the uptake of second vaccinations is, given that it's been 12 weeks between those vaccinations. So obviously we'll be able to report back as this part of the programme gets going as to whether that's we have good uptake of the second vaccine or not. We've agreed a health and inequalities framework and some priority groups for initial attention, and that's available if anyone would like to see it. And then challenges, I think I've probably covered most of them there, but if anybody would like any detail. And then obviously we report back regularly to the community engagement group, which one is later on this evening. So every 2 weeks, obviously, this work is also discussed and debated and reported back with other parts of the community and other community leaders to actually develop this programme even further.
Thanks, Wendy. That concludes our slides. Happy to take any questions or anything that's outstanding. Thank you.
I've got nothing in the chat. I've got Chris with his hand up.
It's a quick question, probably mainly for Diane, but possibly yourself, Andrea and Anthony. The additional shielded patients, we've got just over 7,000. I take it's in additional to the original about 8,000 we had. So we've got about 15,000. The majority of those, there's going to be links to deprivation with ill health and obesity and ethnicity, etc. How does that as a percentage, which I think is what 6-7% of our population, compare with other areas across GM and up and down the country?
That's a very good
I'd
question.
be impressed if
That's an excellent question. And if you haven't got the answer, can we all have that answer?
Yes, we can get that for you. I'll ask my colleague Anthony to get that for us.
Okay. All right.
Thank
you.
You
Stumped them, Chris. All right. Yeah. Anybody else? If not, can I thank everybody? I think we're entering a crucial phase. I do know, Mark mentioned businesses. I do know that when pubs are allowed to open for outdoors, there's been a very marked reluctance by some of the pubs who I've been in contact with in the town centre. And I think one of the reasons is that some of them can survive better now that the government's extended the furlough scheme than if they had to reopen.
Yeah, I think you, Chair, that what we're suggesting is that a very few will open when it's outdoor only, but more will open on the 17th of May because commercially it's more viable because you can get more people both inside and outside. So I think it's a commercial decision. You're right, Alan.
It is. And the pubs that are definitely opening on the, when they're outside are the Regal Moon and the Bourne. Now, I haven't heard any others in the town centre.
The Flying Horse. Those three have come.
Well, no, he's not made his mind up.
Okay. On my list, actually, he has.
he's telling you. Well, he wasn't telling me when he rang me last week.
Yeah, those are the three that we've got confirmed.
Yeah. Okay, if there's nothing else, can I thank everybody? And for those who are on the 6 o'clock meeting, I'll see you at 6 o'clock.